Hello and welcome back. I'm Dr. Bone. Today I want to give some insight about travel while you have a serious illness. For some, travel can be considered an important part of life and crucial to having a good quality of life. Although travel is not necessary to live, there are numerous benefits. It exercises your mind and your body, getting to go to new places, experience new cultures and new people. It provides opportunities to explore new locations and try new things or enjoy different flavors. And for others, it provides a break in the routine. Another reason for many is being able to return to a familiar place or location where important events occurred, will revive memories, or help bring closure. Sometimes being able to go to a family reunion is really heartwarming for everyone. Certainly reconnecting with those family and friends is important. That will bring a smile that lasts long beyond the time of the trip itself. An unanticipated benefit can be to renew the appreciation for what you have and your journey to get to where you are now, how far you and your family have come, and the accomplishments that you all have achieved. Travel is often stressful for anyone, and if one of the people traveling has serious illness, the stress can become much greater. The risks, obstacles, and concerns may seem insurmountable when you first consider travel, yet it can be done. Today I hope to give you some ideas on how to make your travel plans. This discussion is to help you approach your travel needs so that your trip can be accomplished with great success. I do hope listening to this you realize how to make it feasible. Certainly not every one of these considerations is for every person, and with listening to this, you may decide that travel for you is very achievable and pretty easy. You might think that having a serious illness would cause you to postpone a trip or even choose to never travel again. But for some, knowing that time is short, a disease process is going to advance over time with decreased ability and strength or possible cognitive impairment to occur, the need to travel now can become a priority. I hope to teach you that with proper planning and preparation for a trip, it can be safe, fun, dream-fulfilling, and provide a foundation for healing and impactful memories for everyone. Completing something off of your bucket list can be more than fulfilling and give a great sense of accomplishment. Prepare to have a specific physician appointment. You will want to review with your physician your findings about your travel plans. Make a special appointment to speak with the physician about your travel proposal. Be sure to take a list of your plans as well as all the questions that you have to that appointment and have everything discussed in one visit. Ensure what you plan is realistic, discuss your thoughts on safety, and get their ideas on what they suggest to make the trip safer and more comfortable. Check your knowledge about worrisome signs and symptoms of the disease and what would be an appropriate response. Before you go to the physician visit, do your homework, decide where to travel, and research your destination. When you're considering where to go, weather is only part of the things that you're going to want to consider. Be mindful of physician appointments, procedures, or treatments that are upcoming so that you can plan your trip around those. Choosing who will go and who can provide extra assistance is also important. A key fact to keep in mind is, does the person have the ability to stand and transfer on their own? You can still travel even if they can't, but you need to plan for that. Determine the best method to get there. What mode of transportation are you going to use? We'll talk more about that in a moment. Consider if special accommodations or devices will be needed on the way or once you arrive, such as a transfer chair or a wheelchair or a power mobility device. Would you take one? Would you rent one? And do you know how to charge it? Also, where will you stop along the way? What if a detour is necessary, either for you, for the person with the serious illness, or maybe your mode of transportation causes you to have a detour? Other possible things to confirm with the physician are the dietary needs. Are there food restrictions? Is the person fed through a G-tube, and what will you do about formula while they're gone? Hygiene concerns. Is there an incontinence problem? Are there wound care issues that you need to consider? Do you know how to perform that wound care, and will you have an ample supply of dressings or bandages, creams, or salves while you're gone? Talk with the doctor about the length of time for your trip. Short trips may sound great, but if the trip is taxing, if it's difficult to get there, you may want to consider staying for a longer period of time so that you're well rested for the trip back home. Whatever you do, be sure to plan extra time for everything. Then there's the topic of insurance. You have insurance considerations. For sure, contact your health insurance company and learn about their specific policies about travel and how billing would be handled if you were seen in a different area. Do they have a specific network, either of physicians or hospitals? They will provide you a list of those physicians in that area if you tell them where you're going to be traveling to, and you're going to want to write that information down and keep it with you. Plan where you would get help if you needed some assistance for an acute medical situation while you are on your trip, or if follow-up is necessary while you're gone. And if you needed to, how would you abort the trip and return home? Some people find reassurance in having trip insurance in addition to their regular health insurance. So for an individual that's on hospice, that doesn't mean that you can't travel. It almost makes it easier for you. Careful consideration is warranted, and that hospice agency is going to be there to help you. If the patient is receiving hospice, you're actually very fortunate. Your managing hospice provider at home will do many things for you. Mostly, they're going to assist you with finding a hospice agency in the area where you're traveling to, particularly if you're going to be there for longer than a week. The new agency is called the contracted hospice provider, and they will care for you while you're there. Your managing hospice will arrange for follow-up by the contracted agency and provide you information how to contact them when you arrive at your destination. They will communicate with each other, and those physicians will be brought up to speed on what's happening with the health situation, and they will ensure that necessary supplies, not just medications, but other things, other items that you might need, are ready for you at the time you arrive. Many agencies will go above and beyond to help make a travel dream come true. I know that when I worked for hospice agencies, we were actually delighted to help our patients and their families make a travel trip that was maybe the trip of a lifetime. And I always was excited to hear the contracted agency that was going to be receiving our patient, how excited they were to help take care of that person while they were there. The agencies will assist in a wide variety of concerns, anything from nutrition or hygiene or mobility devices and supplemental oxygen needs, and certainly they will help with follow-up while you're away. So let's talk about travel methods. Airplane, car, RV, train, cruise ship, each mode of transportation has its pluses and minuses. For air travel, it is fast for sure, but you got to get to and through the airport. You have to consider wait times. Will cabin pressure be a factor, or will oxygen level be affected during a flight? And if supplemental oxygen is already being used, you're going to have to address that. Consider the seat size and coach fare, and if you can afford it to splurge and go first class, this might be the time for that. If your travel is by vehicle, stopping where and when you want is certainly easier, and you can certainly stop more often than just to fuel up. Travel by RV might be what you decide. You can rent an RV, and it's a great way to have more control as well as comfort and get off some of the more heavily traveled roads. What you need to consider, though, is getting into and out of that RV. Or if you're going to travel by train. Many parts of the United States, we now have train travel, where we didn't for a period of time, and it's a great way to see the landscape and not have to worry about driving or traffic or getting fuel or having a flat tire. For many, taking a cruise is on their bucket list. And if they need, there's medical services on board. However you go, those travel days you're going to want to get up and walk around frequently. The next task to tackle is communicating with the people that you are going to be visiting, and communicate with them well ahead of the visit. If you're going to be visiting family or friends, be sure to give full disclosure. Be honest with those people that you're going to be staying with to ensure they're ready for you and that they have a clear understanding of needs and restrictions. Reassure them that you have addressed mobility concerns, and if not fully addressed, ask how they can assist. Help them manage their expectations of the trip as well. When it's time to pack, Consider packing a week in advance as a practice. Be mindful of the luggage weight. Can the people going physically carry or pull those items? Most luggage now has wheels, and they do make those sturdy, lightweight wagons. Medications, for sure, you're going to want to keep those with you. Prescription meds as well as over-the-counter meds, I recommend having those in their original bottles. But if you've got a long travel day, then you're probably going to want to have a pill planner, because if you're needing medicines multiple times throughout the day, you're not going to want to open those bottles. Have enough supplies to get you through, for sure, till you reach your destination, and then have a plan for how to replenish those if they're needed while you're gone. Other considerations may include hand sanitizer, wipes, hygiene items, or masks. Other items that might be helpful: maybe pack a comfort bag, a bag that contains personal comfort items, tissues, eye drops, chapstick, muscle rub. Will you get hot or cold? Would you need a fan or a blanket? What about a neck pillow or a small back pillow? Have a specific bag that contains the things you think you're going to need to get through a day. And all days, not just travel days, wear comfortable clothes and shoes. Now is not the time for new shoes. If you've been wearing Crocs or booties every day, this is not the time to break in those new shoes. They may not be comfortable, but support stockings or compression stockings may be advised. I also want to cover a few specific health situations, some specific situations. So first, let's talk about traveling with incontinence. This is a very common concern, and you may be surprised to learn that some studies say anywhere from 25 to 40% of Americans have an issue with incontinence. So plan for bathroom breaks often. Locate those bathrooms as if you're on a fun scavenger hunt or playing a bathroom bingo game. Maybe move up in the level of absorbency. Pack a specific bag of toiletries, hygiene products, maybe plastic bags, or possibly a change of clothes, so that you're ready for anything that might occur. Be cautious with fluid intake, but don't severely restrict. Talk to your physician about a catheter for those travel days. Would that be appropriate? Would that be of benefit? But don't let the worry of continence keep you at home when you realize that almost half of the people you're with in the airport or at a train station are also having issues with continence. Now let's talk about traveling with somebody that has cognitive impairment. When you take a person out of the normal surroundings, their routine is disrupted, and thus travel can be very upsetting for somebody with a memory problem. We're mammals, and we thrive on routine, and so the changes of travel can be significant. And sure, we think we're smart because we can use a computer and we have a cell phone, but we're mammals too. And the way your cat wants to sleep in the same place on the bed or by the window, or your dog takes the same path around the house, we're mammals also, and we thrive on routine. So loss of those familiar people or items or clothes or pets can be very disruptive to us. Carefully consider if bringing the pet would make things better or worse, and that might depend on the person as well as depend on the pet. Having extra hands on the trip will help and provide that calm reassurance. You may need one person to be with the patient at all times, and I call that person your anchor in reality. The patient's going to choose who that person is. Unfortunately, you can't designate them. So if you're traveling with someone with memory impairment, someone else may need to always go get the car, go get the luggage, go get the groceries, get the takeout, and check in and out of your lodging while one person is with the person at all times. Also consider ahead of time the what-if strategy. You know your loved one and you know the things that might set them off, so think about what you might do if they do get set off. Use the less is more approach because sensory overload is real, even with clothes. Sometimes loved ones can get attached to a particular article of clothing, and they may have a favorite shirt and or a favorite pair of pants and or a favorite pair of socks. And so what I encourage you to do is pick items that are exactly the same. And then you can write inside of them a 1, 2, 3, 4, and they can't tell the difference by looking at them, but you can tell the difference. So when you get your loved one cleaned up, you take off the pair that's soiled and you put on the identical pair that looks just like it to them, but you know the difference, and then they're not upset about the clothes they're wearing because they think they're wearing the same blue shirt and the same pair of pants that they had on before. Plan for a simpler environment with limited distractions. Consider an Airbnb. These are more likely to have a private entrance as compared to a hotel, and they may be more quiet. These can be more home-like in their location, yet they have fewer items on the counters and the walls. And sometimes, even though we like our keepsakes, I mean, look at the crazy stuff I've got behind me, these things can be distracting and sometimes upsetting for someone with memory impairment. For meals, plan to eat in for most meals. And when you do eat out, be careful about selecting the environment, the location, and the time that it takes to get to where you're going to go to eat. When you eat out, also consider the food types. This is not the time for them to explore something new. A word about sweet treats. If they're eating mostly healthy meals and they eat out and they decide they want a bowl of ice cream for supper, and that's going to be their main course and their only course, that might be okay. Having a battle at mealtime is not necessarily the best time to solve something like that or to approach it. Also, when you eat out, discreetly prepare a little note that you can hand to your server, maybe a card with some information that your loved one has a memory issue. That could go a long way to provide that mealtime goes smoothly for everyone. Be mindful of reorientation. Distraction is less offensive, and I'll go through a do and don't list in just a moment. Familiarity is important, so consider going to a familiar place with familiar people when your traveling companion has a memory concern. For most, those old memories are going to remain intact for the long term. It is not a good time for a bustling trip with new sights and new sounds because that can be overwhelming. It can be upsetting. So manage the expectations ahead of time. Be flexible, as the person with the memory impairment may not be so flexible. So here's my short list of do's and don'ts for memory-challenged folks. Agree, don't argue. Divert, don't reason. Distract, don't shame. Reassure, avoid a lecture. Look for ways to approve, not to scold. Reminisce, but avoid the word remember. Try bringing up an old memory. Wasn't there a time when? Use that phrase. Avoid the phrase, I said. You could try, oh, I thought we decided. Reassure what they can do and avoid the phrase, you can't. Ask, don't demand. Observe strengths, don't condescend. And don't force, try encouragement. Let's move on to talk about shortness of breath. Heart, lung, other condition, it really doesn't matter what the cause of shortness of breath is. Anxiety can play a major role in shortness of breath, and good planning will help reduce the worry and help manage that anxiety. Review with your physician the current oxygen need and supply, and if you're going to be flying, confirm with the airline what they require for you to bring oxygen on board, because remember, they're not going to supply the oxygen. Work with your physician to discuss if flight is a reasonable option and obtain a letter that's going to be necessary for you to bring bring an oxygen concentrator on that flight. There are only a few oxygen concentrators approved by the FAA, and you can look those up online, but it's best to talk with your particular airline about what they allow. Some people already have a portable concentrator, but you don't know that that's a particular type that they're going to allow on board. Battery life typically for these portable concentrators is only a few hours, so if you are going to be flying and you have a layover, you're going to want to make sure you have enough time to charge that concentrator. So unfortunately, a longer layover may be in order. Once again, if your patient is on hospice service, they're going to be assisting you, so you have expert help. Vehicle travel may be the best option if your person has shortness of breath and requires supplemental oxygen, because nebulizer machines and oxygen concentrators have adapters for automobiles, as well as many of the other devices that you're going to be using. Other considerations to put on your planning list: make every effort you can to avoid an infection leading up to and through your trip, whether that's good hand washing, wearing a mask when you're out in public, and skin protection. Remember, skin is your best barrier to infection. Possibly your physician will want you to bring some antibiotics on board, a little course of those, or some steroids or another special medication, but you're going to want to follow their instructions exactly, knowing when and how to use them. Don't take medications just in case. And if you do start a course of antibiotics and you don't think it necessary, before you stop those antibiotics, communicate with your physician. Conserve energy and use a mobility device. A trip is not the time to get into shape. It's not the time to start a new diet, and it's not the time to go crazy wild off of a diet. Be mindful of fluid and salt intake. Do you need to watch for edema? Do you need to check vitals? Once you're there, congratulations, you've reached your destination. Enjoy your time and experiences there. You have thought out and executed your travel plans. The research and planning for your time at the destination has paid off. Relax and pace yourself. Take time doing things and just soak it all in. Being in a rush can sacrifice safety. Be reasonable about your activity, your food, and your beverages. When it's time to head home, heading home is also part of your journey, and it should be fun too. And going home should be less stressful than getting there, as you're going through the same process in reverse. If you did hit a snag on the way getting there, you're going to know what to do and how to deal with that or how to avoid it. The journey to and from are both important parts of your trip. So plan for your trip home in the same way you plan for your trip there. Don't overdo it your last day of your trip. Plan for a quiet day, maybe do laundry, ensure that you've got your bags packed correctly for your trip home. In closing, traveling with serious illness for sure can be done. It does take some planning and it takes some coordination to make it all come together, but the rewards can be tremendous. For those on hospice, rest, or in this case travel, assured, you have experts on your side. I hope this gets you excited and you can see how to approach making a travel plan. I want to help make your travel planning seem less burdensome and more approachable. I wish you every success in your travel adventures. Yodo wants you to live each day to its fullest and have no regrets about the time you spend with your loved ones. Make each day the best. Thanks for watching. Bye now.